Imagine your dog sprinting into the kitchen, just completely out of nowhere, because they heard a cheese wrapper crinkle from like 3 rooms away.
Oh, yeah. They always hear the cheese.
Right. It's incredible. And they are moving with this absolute, just unbridled enthusiasm.
Right.
But now I want you to imagine that same dog has a severe, debilitating spinal injury.
Which is really hard for most people to picture.
It is, because for most animals, or humans for that matter, those two realities cancel each other out. If you're hurt, you don't sprint.
Exactly.
But for a Pembroke Welsh Corgi, those two things can actually happen at the exact same time.
Yeah, and it creates this incredibly dangerous illusion for the owner.
How so?
Well, we have this very human assumption that if someone is in pain, they stop participating in the things they enjoy.
Right. We expect a clear signal, like crying or limping.
Exactly. But working breeds, they just are not wired like we are.
And that brings us to our mission for you today. Welcome to today's deep dive. We are looking at some really comprehensive health and behavioral notes, specifically regarding the Pembroke Welsh Corgi.
It's a really fascinating set of data.
It really is. And our goal today is to teach you how to decode the hidden health signals of a breed that is famously determined, highly stoic, and just notorious for masking what's really going on beneath the surface.
Because they really will hide it.
They will. We want to show you how to look past that big food-motivated smile to catch the subtle underlying changes in their health. So, okay, let's unpack this, because we are dealing with a core dilemma here.
Yeah, the dilemma of the stoic worker.
Right. A dog that still desperately wants to go on a walk can still be harboring immense pain. Or a dog that can stand at the food bowl, they can still be losing their neurological coordination.
And to understand why this happens, you really have to look at what they were engineered to do.
Because they weren't bred to just look cute on Instagram.
No, not at all. These dogs were bred to herd cattle. They were designed to nip at the heels of animals that are, 50 times their size?
Right. Massive cows.
Yeah. And they're bred to take a stray kick to the face, shake it off, and get right back to work.
Wow.
Yeah. That genetic memory, that drive to push through discomfort to complete a task, or in a modern dog's case, to get a treat it, is completely hardwired into their brain.
So let's paint a picture of what this actually looks like on, say, an average Tuesday. It's time for the morning walk.
A classic scenario.
Your corgi is at the door, bright-eyed, watching you grab the leash. But there are a few, micro changes in the pattern.
Very subtle things.
Right. Maybe he pauses before stepping down off the front porch, just a beat longer than normal.
Just a tiny hesitation where there used to be fluid motion.
Yeah. Then, on the walk, one back paw scrapes the pavement.
But not a dramatic drag, right?
Exactly. Not a tragic drag of the leg, just a little scuff of the nails that you'd almost miss if you weren't actively listening for it.
Right.
He hesitates at a curd he's bounded over 100 times. And then, when you reach back to scratch him near the tail, instead of leaning into your hand like he always does, he slightly drops his back, turns his head, and steps away.
And see, taken individually, none of those sound like a medical emergency.
No, you'd probably just think he's sleepy.
Exactly, you'd brush it off. But the crucial part of the scenario comes later that evening.
Right.
He gets up stiffly from his bed, looking like a little old man. Yet the absolute second you open the refrigerator, he is sprinting across the hardwood floor, sliding into the kitchen, begging for a snack.
It totally makes me think of a highly competitive athlete.
Oh, that's a good comparison.
You know, like the kind of hockey player who will play an entire period on a fractured ankle just because the adrenaline is pumping and they just love the game.
Yes, or honestly, it's like a burned out employee dragging themselves into the office when they have the flu.
Right, simply because they heard there was free pizza in the break room.
Exactly. The appetite does not negate the injury.
That is such a huge point.
It is. The drive overrides the discomfort in the moment. The trap of the stoic worker is that the dog isn't purposely trying to deceive you.
They aren't hiding a secret.
No. Their brain just temporarily prioritizes the reward over the pain signal.
Which means the real skill for you as an owner isn't waiting for one dramatic, obvious collapse.
Right, because by then, it's really bad.
Yeah. It's noticing a cluster of small things, the scuff, the hesitation, the touch avoidance, and taking that pattern seriously, even if they still want dinner.
Absolutely.
So, since we know these dogs will essentially mask their pain for a piece of kibble, we need to examine their biggest vulnerability.
The spine.
Yes, because of their low-set, long back structure, the spine is the #1 thing Pembroke owners stress about.
And rightfully so. To understand the spine, we need to look at the mechanics of their body type. The Pembroke Welsh Corgi is a chondrodysplastic breed.
Okay, chondrodysplastic. Break that down for us.
Right, so chondrodysplasia is essentially a genetic variation that alters how cartilage develops. That's what results in those shortened, bowed limbs.
Right, the classic Corgi legs.
Exactly. But it doesn't just affect the legs, it affects the cartilage throughout the entire body, and that includes the discs between the vertebrae in their spine.
Now, those discs, they're supposed to be like little shock absorbers, right?
Yes.
Like a jelly donut sitting between two bones.
That is a perfect analogy. In a dog with typical structure, that jelly donut stays pliable and squishy for most of their life.
Okay.
But in chondrodysplastic breeds, that disc material starts to calcify and degenerate much earlier in life.
Cool. So it dries out.
Exactly. It becomes brittle. Now, degeneration alone doesn't mean the dog is sick, but it sets the stage for intervertebral disc disease, or IVDD.
IVDD, the big one.
Yes. This happens when that brittle disc ruptures or bulges and the material physically presses upward into the spinal cord or the surrounding nerves.
Which explains the symptoms, because if a disc is physically crushing a nerve, that can present as obvious severe pain, right?
Oh, absolutely. Crying out, a noticeably hunched or rigid posture, or suddenly refusing to go up even a single step.
But the data in this deep dive shows it can also be incredibly subtle.
Extremely subtle. A dog with mild IVDD might just quietly stop following you from room to room.
Oh, wow.
Yeah, they might isolate themselves under a table.
Just to avoid moving.
Right. Now, we have to contrast IVDD with another condition that veterinary data shows gets confused with it constantly.
Which is degenerative myelopathy, or DM.
Yes. What's fascinating here is how fundamentally different the mechanisms of these two diseases are, even though they both affect the spine and the back legs.
Yeah, let's break that down.
Okay, so with IVDD, you have physical compression. A disc is pinching a nerve. But with degenerative myopathy, there is no pinching at all.
None.
None. DM is a genetic, late-onset disease where the white matter of the spinal cord itself degrades. Specifically, the myelin sheath, which is the protective insulation around the nerves, it just slowly wastes away.
Oh, so it's like a frayed electrical cord. The brain is trying to send a signal saying, hey, move the left back leg. But the signal literally gets lost in transit because the insulation is gone.
That's a great way to picture it.
It's like playing a video game with a lighty controller. You press jump, but the character just keeps walking.
That is exactly how it functions. And that brings us to the primary distinction for owners trying to spot the difference between the two.
Okay, what should they look for?
Because IVDD is a physical pinch, it is often sudden, it frequently involves acute pain, and it can happen to a 3- or 4-year-old dog.
Right.
But because DM is a gradual wasting of the nerve coating, it tends to show up much later in life, usually in senior dogs.
And it progresses slowly.
Yes, very slowly. And it is overwhelmingly described as non-painful.
Really? Non-painful?
Yeah. The dog isn't crying, they are just genuinely confused about where their back feet are.
Wow. But hang on, let me ask you this. If early degeneration makes those discs brittle and sets the stage for IVDD, doesn't that validate the biggest fear every Corgi owner has?
You mean the couch?
Yes. The dreaded jump off the couch.
Yeah.
I know people who won't even let their dog look at a step without panicking and swooping them up.
Oh, I know. It is the most common fear in the community. But the veterinary consensus pushes back on this narrative pretty hard.
Oh, really?
Yeah. One single fateful jump off the couch is not what causes disc disease.
It's not.
No. IVDD is a complex, cumulative mix of their inherited structure, that early cartilage degeneration we talked about, their age, their body condition, and honestly, a certain amount of genetic chance.
So the underlying brittle disc is the real culprit. The jump is just the straw that breaks the camel's back.
Yes, exactly. The disc was already a ticking time bomb. The jump was simply the movement that triggered the rupture.
Okay, so what does that mean for everyday life?
It means risk reduction doesn't mean living in a state of constant paralyzing terror. It means focusing on what you can control.
Like their weight.
Yes. Keep them at a lean weight, provide rugs or runners for good traction on slick hardwood floors, and stop habitual high-impact jumping.
Right, like flying off the bed 5 times a day.
Yeah, that is bad for the joints over years. But a dog navigating a normal carpeted living room shouldn't be treated like they are made of glass.
That makes total sense. Now, it's human nature to want to play doctor.
Well, for sure.
We see a dog limping or acting stiff, and we immediately want to poke and prod along their spine to find the sore spot.
Which you should never do.
Right, because with this breed, amateur diagnostics can cause real, irreversible damage. If a disc is unstable, pressing down on their back could push that disc material further into the spinal cord.
You never press on the spine, period. And we really need to draw a hard line on what constitutes an absolute emergency here.
Yes, let's go over that.
Sudden weakness in the back end, severe pain, dragging a limb, a sudden loss of coordination, an inability to stand, or trouble urinating.
Those are major red flags.
Those are drop everything and go situations.
Oh, no.
You call a vet or an emergency clinic immediately.
There is no wait and see with paralysis.
None.
You do not try a home massage, you do not try to adjust their back like a chiropractor, and you never, ever give them human pain medication like ibuprofen.
Oh, absolutely not. That can be highly toxic to dogs.
Yeah, don't do it.
And just a quick note on DM genetics while we're talking about the spine.
Yeah, go ahead.
If you run a DNA panel on your dog and get an at-risk result for degenerative myelopathy, remember that it is just a susceptibility marker.
Right, it's just a piece of information.
Exactly. It's not a countdown clock. Many dogs with 2 copies of the gene live their entire lives and pass away from old age without ever developing clinical signs.
That's reassuring. So let's transition from the spine to the rest of the body.
Okay.
Because if a corgi scucks a paw or starts limping, an owner's mind immediately jumps to a spinal tragedy. But a limp is often just a limp.
Right. It could be the hips, or it could just be the paws.
Let's talk about the hips first.
We have to talk about hip dysplasia. There is a very common misconception that short-legged breeds don't get hip dysplasia, or that their low center of gravity somehow protects them from abnormal joint fit. But it doesn't. It absolutely does not. How does that actually work mechanically? I mean, with their short legs? Well, the hip is a ball and socket joint, regardless of leg length. In a healthy hip, the ball fits tightly into the socket and glides smoothly during movement. Oh. In a dog with hip dysplasia, the joint develops abnormally. It's loose. So instead of gliding, the ball and socket grind against each other.
Ouch.
Yeah. And over time, that friction causes the body to build up bone spurs to try and stabilize the loose joint.
Which leads to painful arthritis.
Exactly.
Which you might see as stiffness after resting,
Yeah.
trouble getting up, or, and I've seen this, a hoppy bunny-like gait when they try to run fast.
Yes, because it physically hurts to extend the legs independently.
But what if it's not the hips or the spine at all? What if we're just overthinking it?
That happens a lot. It is always worth doing a gentle visual paw check before assuming the worst.
Right.
A dog in paw pain will shift their weight and hunch their back in a way that perfectly mimics a major structural problem.
Wow, just from a sore paw.
Yeah, it could simply be a torn pad from hot pavement, a cracked nail, or, a burr stuck in the webbing between their toes.
So what does this all mean? It means we are dealing with a master of disguise.
A very fluffy master of disguise.
Yes. And I think the best way to visualize evaluating a corgi's external health is to compare it to checking the structural integrity of a house.
Okay, I like this.
You can't know if the framing is rotting just by looking at the vinyl siding, right?
No, you have to look underneath.
Exactly. A corgi's broad build and that incredibly thick, weather-resistant double coat, it acts like physical camouflage.
That double coat is genuinely brilliant at its job, which is protecting the dog from the elements.
Yeah.
But that also means it is exceptionally good at hiding redness, hot spots, lumps, ticks, and even profound hair loss.
Right.
You can look at a corgi from 2 feet away and think their skin is flawless, while underneath, they have a massive weeping skin infection.
That's terrifying.
It is. You cannot just glance at them. You have to physically part the hair all the way down to the skin with your fingers.
And the exact same illusion applies to their weight, right?
Oh, absolutely.
Because they're built like little submarines, broad, low, and dense. A gradual weight gain is practically invisible to the eye.
Completely invisible.
And a 1-pound gain on a 25-pound dog is the equivalent of a 6 or 7-pound gain on an average adult human.
Which is massive for them.
Yeah.
You have to check their ribs and their waist by hand regularly. You should be able to feel the ribs easily under a slight layer of fat without having to press hard.
Because extra weight adds tangible mechanical strain to a spine and hips that are like we said, already prone to issues.
Exactly. It removes a vital layer of structural protection.
And the scale can totally lie to you.
Yes, it can.
An older dog might be losing muscle mass in their hindquarters because they're hurting and they've stopped using those muscles.
Right.
But at the same time, they're gaining fat around the middle from inactivity.
So they weigh exactly the same at the vet's office.
Exactly. But their body composition is deteriorating. You have to physically feel the dog.
And a very practical tip from the veterinary community regarding these external issues. If your dog is limping intermittently, film it.
Film it.
Yes. Film it naturally at home,
Yeah.
walking away from you, walking toward you, or getting up from a nap.
Oh, because they act fine at the vet.
Exactly. Dogs are notorious for getting to the vet clinic, getting flooded with adrenaline, and magically walking perfectly.
Oh, I've seen that happen.
But a huge caveat here, never force the dog to move or provoke the pain just to capture it on video.
Care first, documentation second.
Always.
Also, regarding the skin issues we mentioned earlier, one of the sources noted this. Don't change their food, their shampoo, and add new supplements all in the same week.
Yes, that's crucial, because if the skin clears up or gets worse, you'll never know which of those three things actually caused the change.
Right. It's wild how well that double coat hides things on the outside, but their stoicism is even more dangerous when it comes to what's happening on the inside.
Oh, for sure.
Because a dog that will hide a limp to get a treat will absolutely hide internal pain, like a bleeding issue or severe dental disease.
Let's talk about the blood first. Von Willebrand disease, or VWD.
Okay, VWD.
It's a known inherited bleeding disorder in the breed.
How does that actually affect the dog?
So they are missing or have defective von Willebrand factor, which is essentially a sticky protein in the blood.
A sticky protein.
Right. When a healthy dog gets a cut, that protein acts like glue, helping platelets clump together to form a clot and stop the bleeding.
Okay, so without enough of that sticky protein.
The platelets just can't clump, a minor cut just keeps seeping.
Which is why having this on your dog's medical record before any procedure is non-negotiable.
Absolutely non-negotiable.
If they need a routine tooth extraction, the vet has to know to have specific clotting protocols ready.
Yes. And signs of this at home might look like a bloody nose that won't stop, bleeding gums just from chewing a regular toy, or bruising on their belly that seems totally disproportionate to whatever small bump they took.
Wow. Okay, so moving from the blood to the eyes.
The baseline rule for eyes is to watch for sudden clumsiness, especially in dim light.
Which can indicate progressive retinal issues.
Right, exactly. Watch for squinting, excessive tearing, or cloudiness.
And we need to emphasize a massive warning here. Never use leftover human eye drops on your dog.
Or even old prescription drops from a previous canine eye issue to treat a new problem.
Right. Tell them why, because it's scary.
The mechanics of eye issues make this incredibly dangerous. Let's say your dog is squinting.
Okay.
It could be allergies, or it could be a corneal ulcer, which is a scratch on the surface of the eye.
Okay, a scratch.
If you grab an old bottle of drops that happens to contain a steroid, which is super common for allergies, and put it in an eye with an ulcer, the steroid suppresses the local immune response.
Oh, no.
It literally prevents the eye from healing and can cause that ulcer to melt deep into the eye in a matter of days.
Melting the eye.
Yes, risking the loss of the eye entirely.
That is horrifying. So different problems require completely different chemistries. Don't guess.
Do not guess.
Now let's talk about their teeth and their digestion, which loops us right back to their defining trait, that intense food drive.
It really all comes back to food.
It takes a staggeringly resilient, or maybe just stubbornly obsessed animal to physically crack a molar, expose the root, and still aggressively demand their dinner.
Right.
Most humans get a slight cavity and we're miserable eating soup for a week.
But a corgi will eat enthusiastically right through a fractured tooth or a severe gum infection.
Which means appetite loss is almost never your first tell with this breed.
Right. Instead, you have to watch the mechanics of how they eat. Are they suddenly dropping kibble out the side of their mouth? Are they shifting their food to chew exclusively on the left side? Are they suddenly ignoring that hard nylon chew toy they usually love?
Okay. And that exact same intense food drive leads to the other big danger. Dietary indiscretion.
Swallowing things they definitely shouldn't.
Toys, packaging, socks.
They are essentially walking vacuums.
Yeah, they are. So persistent vomiting, dry heaving, or lethargy is a huge red flag for a blockage.
And owners should never try to induce vomiting themselves at home with hydrogen peroxide.
Unless specifically directed by a vet in real time.
Exactly. Because if the object they swallowed is sharp, Bringing it back up can tear the esophagus.
If we connect this to the bigger picture.
Well, if we connect this to the bigger picture, all of this internal tracking comes down to establishing baselines.
Knowing what's normal for your specific dog.
Yes. Knowing their normal water intake, knowing how often they usually ask to go outside, running your hands over their body during a petting session to check for lumps while they're totally relaxed.
Because knowing what is normal is the only way you will spot the subtle deviations when those internal systems start to struggle.
Exactly.
Which brings us to our final and maybe most critical realization of this deep dive.
Okay.
If a Corgi is going to stoically hide their physical pain to keep working and to keep eating, how do we really know when something is wrong?
The answer is their behavior.
Yes. Behavior changes long before the body completely gives out.
Behavior is the ultimate vital sign. It is often the very first faint indicator of an underlying medical issue.
Here's where it gets really interesting, because human nature often misinterprets these signals entirely. Let me share a scenario from the data that perfectly illustrates this.
Go for it.
Imagine a family with a 5-year-old Corgi. He's been perfectly potty trained his whole life. Suddenly, he starts peeing in the hallway at night.
Okay.
A week later, when the husband goes to scoop him up off the couch, the dog growls and snaps at him.
I see where this is going.
The family assumes the dog is acting out, trying to establish dominance, or regressing. They spend $1,000 on a behavioral trainer to fix his attitude problem.
It's a very common and very tragic assumption.
Right. But a month later, they finally take him to the vet for an annual checkup. And an exam reveals severe arthritis in his hips and lower back.
Man wasn't being stubborn at all.
No. The dog wasn't acting out. He was peeing in the hallway because it physically hurt too much to navigate the deck stairs in the dark to go outside.
Right.
And he snapped at the husband because being lifted sent his shooting pain straight through his spine.
We have to reframe these moments. Sudden irritability, avoiding touch, hiding, or losing their house training, these are not sudden bouts of disobedience.
They are bright red medical flags.
Yes. Now, alert, barking at the window, chasing the cat, following you into the bathroom, that is normal Pembroke Welsh Corgi temperament.
They are nosy.
Very nosy. But any sudden change in their established baseline behavior requires a veterinary workup, not a harsher obedience regimen.
So as we wrap up this deep dive, mastering the health of a stoic working breed is really about pattern recognition.
Paying attention to the whole picture.
Exactly. It's noticing that the back paw is scuffing, and they hesitated at the curb, and they didn't want their lower back scratched.
You take that cluster of subtle clues seriously.
Yes, even if the dog is still grinning ear to ear the second you open the fridge, you have to learn to look past the smile.
And to help manage all those subtle clues, keep your records organized.
Definitely.
Utilizing tools like the Vital Pet app can really help you track care routines, baseline weights, and medication history, so you have a clear timeline ready for your vet when you do spot a change.
And as always, a quick reminder that this deep dive is for educational purposes. It is not a replacement for professional veterinary advice. If your dog is showing signs of distress, consult your vet immediately.
I want to leave you with a final thought to ponder today.
Okay, let's hear it.
The next time your dog is blowing off their recall command, getting weirdly possessive over a space on the couch, or aggressively chasing ankles, before you just sigh and assume it's their stubborn herding instinct kicking in again, ask yourself, are they just acting out, or are they quietly trying to tell you that something hurts?
That is a great question to end on. Thanks for joining us on this deep dive. We'll see you next time.